Good evening, my dear sisters and brothers. It's a privilege to be over here. So I was, jokingly wanting to ask. I was very tempted कि डॉक्टर राज कोई ऐसी चीज बता दो जो कि पेशेंट्स की राइट्स नहीं है, because everything is like patients' rights and privileges and less of responsibilities, and doctors की rights तो खैर even law does not provide enough. So anyway, from what I know of law as applied to doctors, uh, I'll talk a little bit about rights, and I've taken this privilege to include the word privileges, because you see, if we talk very strictly about rights and privileges, rights only, there is very little as far as rights of doctors are concerned. So indirectly, there are privileges granted under the code of medical ethics and by the Indian legal system, in so many ways. But there are very few, and that we can be proud of, not only as a upright doctor, but also as a privileged person. And I always say that doctors have a very special role to play in the legal system of this country, and for it is for this reason that they are privileged, despite knowing this fact that we are one of the most downtrodden in the society, and we are at the receiving end always during our medical practice. But we still do have privileges as far as the legal system is concerned, and you realize them when you encounter situations between the doctor and the law, whether it is at the level of a court or at the level of a police station, or any other way, directly or indirectly, during our dealings. So coming to the topic, direct rights and privileges of a doctor. So I'll divide into two parts. One is the general rights and privileges of a doctor, just like any other citizen of the country, and specific rights. So as far as general rights are concerned, there will not only to us, the doctors, but to the patients equally. And our constitution, or I would say legal system, is such a beautiful system that it grants certain rights to foreigners who are not citizens in the country as well. Or of course, they are not as comprehensive as for an Indian citizen, but they are there nevertheless. So just to summarize, rights and privileges doctors would be the fundamental rights granted to each every person in the country: the right to registration and practice modern scientific medicine, right to suffix name with recognized qualifications, right to sign certificates, right to choose patients, right to advertise. Yes, there are limited, but they are there. Right to dispense medicines, right to recover fees, right to consultation by telemedicine, right to appeal, and right to autonomy and privacy. Although in a very very small context, it is there, but it is there. So we may need it sometimes, and it does gives us a sense of responsibility, not only a right. So coming to the first and foremost, that is the fundamental rights. As I said, it is applied not only to doctors, but to patients as well, and to every citizen and non-citizen in the country in a limited way. And and why is this so? Because our constitution is one of the most, it is the longest written constitution in the world, uh, and it is made up of 448 articles, 22 parts, 12 schedules, 5 appendices, and a preamble to the constitution. It was adopted in 1949, but finally became effective on 26 January 1950, which we all know. Dr. B.R. Ambedkar was the founding father of the Indian Constitution, and a very, very strong pillar. When we study law, we study so much about him and his extraordinary knowledge. There is a museum dedicated totally to B.R. Ambedkar, which is on Shamnath Marg. I had the opportunity to see it this time early this year, and it is a must-watch thing, because you know so much not only about him, that personality, but about our constitution in general. That how was it formed, and what is the strength of our constitution. So as far as the fundamental rights are concerned, they are enshrined in Part 3 of the Constitution, from Article 12 to 35. And whenever we talk of rights, as Dr. Kohli was rightly saying, that every right comes with a sense of duty. And when I say sense of duty, here it comes with a legal duty called as fundamental duties. They are enshrined under Part 4A of the Indian Constitution. And as far as rights are concerned, rights are given under many pages. The total constitution is almost more than 400 pages, and almost 40 to 50 pages are dedicated on fundamental rights, and there is only a single page dedicated on fundamental duties of our of the citizens of this country. So as far as the fundamental rights are concerned, just a very brief, so that although this is not directly related, but that that there are so many things that give us a strength and a voice whenever a doctor's rights are infringed in a court of law. So it is described as the Magna Carta, and Magna Carta used to be the original document written by the or produced by the King of England as early as 1215 AD, and the Constitution of India provides 6 fundamental rights. Although originally there were 7, the 7th was the right to hold property, but that was deleted through the 44th Amendment of Indian Constitution 1978. So now there are 6: right to equality, right to freedom, right against exploitation, right to freedom of religion, cultural education rights, and right to constitutional remedies. So I'm not going to talk about them in detail, but just about the important the fundamental concepts of fundamental rights. And they are that these rights are protected by the Constitution of India. They are not sacrosanct or permanent or absolute. So if somebody says Bharat tere tukde honge and all, so it is not about freedom of speech, because these rights are not absolute rights, they are relative rights, and we know the difference between relative and absolute. So only in certain circumstances can these rights be curtailed, and in any case the right to freedom and so many other rights, they are not absolute rights, and it comes from the Constitution. Constitution is the most fundamental document of the Indian legal system. The entire legal system originates from the Indian Constitution, and that is why we repeatedly refer to it in case of a controversy or a debate. So there it is very clearly outlined through not only common law, through Supreme Court judgments, but also through the Constitution, that these rights are not absolute. They are relative rights. These rights are justiciable. That is, if somebody's rights are being violated, one can approach the High Court and the Supreme Court to get those back, and the rights can be suspended. And there are restriction of laws in many sectors, and in fact, in case of an emergency, not in an internal emergency or an insurgency, but in an external emergency or a war, all the fundamental rights can be curtailed by the legal system. Now, coming to the specific rights, so very quickly, right for registration as a registered medical practitioner, commonly called as a allopathic doctor. The right for registration as RMP in practice and practice modern scientific medicine is given under section 11(1) of the first schedule of Indian Medical Council Act 1956, which is repealed by the National Medical Council Registered Medical Practitioner Professional Conduct Regulations 2023, specifically section 3D. Okay. Now the next is the right to suffix name with recognized qualifications. It is there under section 3B of NMC regulations. Yes, it is on hold, but it is by any time after the election likely to come back again into force. And it was kept on hold after the huge controversy over the mandatory provision of writing generic names only of all the medicines by all the doctors in this country, especially allopathic doctors. So it was taken back. After small edits or whatever, it is likely to come back in its original form, maybe with a little edits here and there. So every doctor can suffix the name with recognized qualifications, degrees, diplomas, whatever. Right to sign authenticate certificates, it is again there. So I'm talking about both IMC Act, which is repealed, and also I'm talking about NMC Regulations 2023, which is going to repeal the IMC Regulations 2002. So right to choose patients, this is something that we never knew about, but yes, it was there in the 2002 regulations as well. And now section 26 NMC regulations 2023 also makes it clear that we can choose patients except in an emergency. Having accepted a case, the RMP should neither neglect the patient nor withdraw from the case without giving adequate notice to the patient and his family. And how do you give a notice? People ask me. So you simply tell them verbally and make a note on the case file that patient has been informed. It is good if the patient countersigns it. If the patient does not, it is all right. You can give the case to another doctor who could take care of the case. So what are these situations where we can, the guideline 5 preamble also says that you can refuse treatment in certain situations. What are the situations where you can refuse to see a patient? Of course, these are all elective situations, not emergency situations. Patient is violent or abusive, non-compliant with your treatment protocol, either with medication or the advice that you offer to the patient. Patient does not pay you enough fees, patient is lying repeatedly and not following instructions, or you are yourself unwell to consult a patient. So they very categorically you can refuse to see a patient, but it also says that you must make a note of it and explain the reason in the case file as to why you are refusing to see or consult the patient. Then the next is right to advertise. You can advertise as per section 11 of the regulations 2023 on starting a practice, on changing the type of practice, on changing the address, on temporary absence from duty, on resumption of practice after a leave, on succeeding to another type of practice. Earlier you were a MBBS, now you are a gynecologist. So, and on public declaration charges, you can advertise for these situations in social media or on print media or moving media, whatever. But you can do that repeatedly. Okay. The next is the right to dispense medicines. It was there earlier as well under regulations 2002. It is also there in section 12 of regulation 2023. But to patients only. You cannot run an open shop of medicines, and you not only medicines, you can give appliances like maybe a nebulizer, maybe a splint an orthopedic surgeon wants to give, maybe a hearing aid an ENT doctor wants to dispense to a patient and give a bill of consultation including that appliance. So it is very much legal and it does not amount to selling. Of course, you cannot sell it to people from outside who are visiting your clinic only for that purpose of medicines or appliances. You can dispense it to your own patients only whom you have consulted through a prescription. The right to recover fees. It was not very clear, in the regulations 2002, but it was there in IMC Act, which is now repealed by the NMC Act. And the NMC Act section 6 says that consultation fee should be made known to the patient before examination or treatment of the patient. Reasonable estimation of the cost of surgery or treatment should be provided to the patient to enable an informed decision. RMP can refuse to treat or continue to treat a patient if the fees as indicated are not paid. At the same time, this does not apply to doctors in government service or emergencies, but the doctor must ensure that the patient is not abandoned. Why government service? Of course, because they are paid by the government to do this job. And emergencies goes without saying, enough evidence that you cannot do that. Right to consultation by telemedicine. It is under section 29 of regulations 2023 that any RMP or one who is registered with the state medical council can practice telemedicine under telemedicine practice guidelines. Right to appeal. In case of an RMP who is aggrieved by the decision of a state medical council, has the right to file an appeal to the ethics. The NMC has 4 boards: the UG board, undergraduate, the PG board, the postgraduate medical education board, the EMRB, ethics and medical registration board, and the fourth is the uh, accreditation and rating board, something like AMRB, accreditation and medical rating board. So you can file an appeal against the decision of state medical council. We have done it in many cases to the national medical council within 60 days from the receipt of order by the state medical council. So and the NMC can give a further 60 days extension beyond the 60 days. So total 120 days. That is within 4 months you can appeal to the Ethics and Medical Registration Board against the order of the State Medical Council. Right to autonomy and privacy of RMP. So this is the last one. This is a short, sweet presentation because rights, as I said, are very limited. Rights and privileges, and some of these, as I told you, are not specifically rights. As with using the word right in the legal system, they are simply privileges, and some of these are overlapping with duties that a RMP has to perform under law. So as far as autonomy and privacy of the RMP are considered, it is a very limited context in telemedicine. That RMP should not participate in telemedicine if it violates the legal or ethical framework of professional behavior or any rules or regulations under the NMC Act of 2019. Telemedicine can potentially infringe on the free time of registered medical practitioners if there is round the clock virtual availability. So the NMC recognizes this fact that the RMP cannot be available 24 hours at the beck and call of a patient. The RMP needs to inform patients about their availability and recommend alternative or emergency services if they are inaccessible. The RMP should exercise their professional discretion in deciding whether a telemedicine or an in-person consultation would be appropriate. RMP should exercise professional judgment and discretion in selecting appropriate telemedicine platform to be used. The RMP has the right to pause his teleconsultation and recommend an inpatient consultation at any opportunity that he thinks wise. Sometimes patient insists, no doctor साहब आप दवाई लिख दीजिए, but you can as per law choose not to continue telemedicine and insist that no, I cannot write medicine unless you uh, have yourself examined by me or any doctor in person. you know there are situations that we encounter many times, so we can exercise that right. It is not that if he's paid fees, so we have to write medication. It's not like that. So just to summarize, at the end of my presentation, once again, that there are fundamental rights that are accessible to, or there are right to every citizen of the country, whether it is a doctor or a patient. The right to registration, practice modern scientific medicine, right to suffix name with recognized qualifications, right to sign certificates, right to choose patients, to advise, right to dispense medicines, recover fees, consultation by telemedicine, appeal, autonomy, and privacy. So, just to end, there are very few rights if you see, but more duties, which we commonly, we wonder that why Gaurav is not talking about those, but most of these are duties and not rights per se. So, this was from my end, Dr. Leena. Over to you.
Thank you very much.